history of the world, only a few generations have been granted the role of defending freedom in its hour of maximum danger. I do not shrink from this responsibility. I welcome it. I do not believe that any of us would exchange places with any other people or any other generation. The energy, the faith, the devotion which we bring to this endeavor will light our country and all who serve it. And the glow from that fire can truly light the world. And so, my fellow Americans, ask not what your country can do for you, ask what you can do for your country. My
Welcome back, truth seekers, liberty lovers, and fellow rebels, to Musings of a Cigarette Smoking Man. I'm Stephen Leake, singer, songwriter, truth teller, your friendly neighborhood DIY indie rocker. Got my pink Converse in the clay of Carolina, and my heart still set on revival. We're not here to play nice with the establishment, are we? We're not here to entertain the empire. We're here to remind people what freedom sounds like, and sometimes freedom sounds like asking questions they don't want you to ask. So let's dive headfirst into the controversy, shall we? Today's topic is a real lightning rod, ivermectin, a possible cure-all? Question mark. That's the question we're tackling today. I know some of you are already reaching for the off switch, convinced I finally lost it. But hear me out. We're living in a world where medical narratives are tightly controlled, where dissenting voices are silenced, and where pharmaceutical giants hold more sway than ever. In such a world, it is our duty, our libertarian duty, to question everything, to dig deeper, to explore the paths less traveled. Ivermectin, the name itself conjures up images of misinformation and conspiracy theories, doesn't it? But what if there's more to the story? What if the widely dismissed medication actually holds untapped potential for treating a range of ailments? What if the powers that be are deliberately suppressing this information for their own profit and control? That's what we're going to explore today. We'll be challenging the prevailing narratives, examining the evidence, and empowering you, the listener, to make informed decisions about your own health. We'll be talking about medical freedom, personal responsibility, and the importance of questioning everything. We'll also be offering some solutions for self reliance, including how to ensure you have access to clean water when the system fails. So stay tuned. Welcome back to Musings of a Cigarette Smoking Man. So, we're talking ivermectin, a name that's become shorthand for controversy, for division, for a lot of shouting into the void. But before we get into all the noise, the mudslinging, and the outright lies, let's step back. Let's do what we do best here on Musings of a Cigarette Smoking Man. Let's look at the history. Let's examine the truth before it was buried under layers of political spin and corporate agenda. Because ivermectin isn't some brand new experimental concoction, it's a drug with a lineage, a track record, a story that stretches back decades. And if you want to understand why it's become such a battleground, you've got to understand where it came from. It isn't just about a drug, it's about the integrity of science, the freedom of information, ultimately your own liberty. The story of ivermectin begins not in a sterile corporate lab focused on maximizing quarterly profits, but a man with a name called Satoshi Omura, a brilliant Japanese scientist. Omura, driven by a genuine curiosity and a desire to find natural solutions, was exploring compounds derived from soil microbes. He wasn't looking for the next blockbuster drug to sell at an astronomical price. He was looking for answers, for ways to combat disease and suffering. In the late 1970s, Amura isolated a novel ivermectin derivative from the bacterium Streptomyces avermentilius, found in a golf course in Japan. This wasn't just another chemical compound, it was a revelation. It demonstrated potent antiparasitic activity, but Amura didn't stop there. He collaborated with the pharmaceutical company Merck. Together, they refined this discovery into what we know as ivermectin. And what did this refinement yield? A drug so revolutionary, so effective, that it fundamentally changed the landscape of global health. Ivermectin proved to be an absolute game changer in the fight against parasitic infections. Think about diseases like river blindness, also known as onchocerciasis, and lymphatic filariasis, commonly called elephantiasis. These are debilitating, disfiguring diseases that have plagued humanity for centuries, particularly in some of the world's poorest regions. Before ivermectin, the options for treating these conditions were limited, often toxic, and largely ineffective. Then came ivermectin. Merck, to their credit, and we'll get to the nuances of corporate benevolence later, decided to make ivermectin freely available to countries suffering from these neglected tropical diseases. They launched a program called the Mectizan Donation Program. Mectizan is a brand name for ivermectin. This program, launched in 1987, was nothing short of miraculous. It provided the drug free of charge to millions upon millions of people who would otherwise have no access to it. The impact was profound. River blindness, a disease that causes blindness and severe itching, was brought under control in many areas. Lymphatic filariasis, which leads to severe swelling and disability, saw its transmission drastically reduced. It was a triumph of scientific innovation and, dare I say, humanitarian effort. The success was so monumental, so undeniably positive, that in 2015 Satoshi Omura, along with William C. Campbell, an Irish biologist, was instrumental in developing ivermectin from Omura's discovery, were awarded the Nobel Prize in Physiology for medicine. The Nobel Committee recognized their work for discoveries concerning a novel therapy against infections caused by roundworm parasites. This isn't just some fringe opinion. This is the highest scientific honor in the world, validating the power and efficacy of ivermectin. It wasn't just for humans in far-flung corners of the globe. Ivermectin also became a cornerstone of veterinary medicine. It's used to prevent heartworm disease in dogs and treat a wide range of internal and external parasites in livestock. It's a staple. Farmers and veterinarians rely on it. It's considered safe, effective, and crucially affordable. Affordability word, isn't it? For decades, ivermectin has been a low-cost, high-impact medication. It was generic. It didn't require massive marketing campaigns or multi-billion-dollar research and development costs associated with novel patented drugs. It was simply effective and cheap. This is where the libertarian lens starts to sharpen. We believe in individual liberty, in personal responsibility, and in the freedom to make choices about our own lives, including our health. We also understand that power, whether in governmental or corporate, position often operates on principles of profit and control. When something is as effective and safe and as cheap as ivermectin, it disrupts the established order. It challenges the existing paradigms. The powers that be don't like being challenged. Think about it. You have a drug that for decades has been lauded by the scientific community, recognized by a Nobel Prize, that used safely and effectively across veterinary and human medicine to combat devastating diseases. It's cheap to produce, widely accessible, has a remarkable safety profile. It's a drug that empowers individuals and communities by offering a simple, affordable solution to complex health problems. Now, fast forward to a recent global health crisis. Suddenly, the same drug, with its stellar reputation, proven track record is demonized. It's labeled as dangerous, ineffective, and a conspiracy theory. It's actively suppressed by major media outlets, ridiculed by prominent health organizations, and often made difficult to access through regulatory hurdles. How does a drug with such a history of hope transform into a symbol of hypocrisy and distrust overnight? This is precisely the kind of narrative shift that we need to dissect. It raises crucial questions. If ivermectin was so beneficial for river blindness and parasitic infection, what changed? Was it a sudden dramatic discovery of its inherent danger, or was it something else, something more calculated? From a libertarian perspective, this dramatic reversal smacks of an agenda. When a cheap, effective, off-patent drug emerges that could potentially alleviate suffering and reduce the reliance on more expensive, newer treatments that often come with a hefty price tag and lucrative patent protections. It's a threat to certain economic interests. It's a threat to the established pharmaceutical model that relies on continuous innovation of patented products. Could it be that the very affordability and accessibility that made ivermectin a hero, the fight against neglected tropical diseases, made it a villain in the narrative of global pandemic? When you control the narrative, you control the perception. And when you control the perception, you can direct the market. You can steer people towards solutions that are far more profitable, even if they are not necessarily more effective or safer. The history of ivermectin is a testament to what happens when science is allowed to flourish, driven by genuine inquiry and a desire to alleviate suffering. It's a story of how a humble soul microbe gave us a tool that saved millions. But the recent turn of events also serves as a stark warning. It highlights how easily that scientific integrity can be compromised. How quickly established narratives can be manipulated, and how profoundly corporate interests and political agendas can warp public perception. This isn't just about debating the merits of a single drug, it's about the integrity of the scientific process itself. It's about the freedom of information and the right of individuals to access and evaluate all available data, rather than being dictated by the select few who claim to hold a monopoly on truth. It's about recognizing that when a universally praised, Nobel Prize winning medication suddenly becomes a pariah, we have a moral and intellectual obligation to ask why. What was the real motivation behind the widespread condemnation of ivermectin? Was it truly about saving lives, or was it about protecting revenue streams and maintaining control over the medical landscape? These are the questions we must grapple with if we are to remain free, informed, and sovereign individuals. The history of ivermectin is a powerful lesson, a roadmap of hope that has been tragically distorted by a narrative of hypocrisy, and we as truth seekers must unearth that original map. All right, folks, let's take a quick break from the medical deep dive to talk about something just as crucial: self reliance. In a world that feels increasingly uncertain, where supply chains are strained and freedom seems to shrink daily, being prepared isn't just smart, it's a statement of independence. That's why I'm partnering with My Patriot Supply. These aren't just your grandpa's dusty survival kits. My Patriot Supply offers high quality, reliable preparedness solutions, from long term food storage to emergency supplies, all designed to help you take control of your family's well being. Look, we're not doomsdayers here, we're libertarians. We believe in personal responsibility, and that means being ready for whatever life throws your way, whether it's a natural disaster, economic instability, or just plain old government overreach. Having a backup plan is an act of freedom. My Patriot Supply empowers you to have that backup plan. They provide the tools you need to weather any storm. You're not reliant on a system that may fail you. Think of it as an investment in your liberty, insurance you can eat, a tangible expression of your self sovereignty. The Great Divide, mainstream versus the people's narrative. Welcome back to Musings of a Cigarette Smoking Man. We've just scratched the surface of ivermectin's remarkable history, a history painted with Nobel Prizes and global health triumphs. But as we all know, the real story, the one that matters most to us, the ones who value truth and liberty, is the one being fought over in the trenches of public perception. And that, my friends, is where the great divide truly lies. We're talking about the chasm between the mainstream media, the established medical institutions, and the pharmaceutical complex wants you to believe, versus an ever growing number of independent doctors, scientists, and ordinary citizens are discovering and sharing. It's a battle for the narrative, a battle for your mind, and ultimately a battle for your health freedom. Let's call it what it is: the vilification of ivermectin. The official story, the one you hear repeated ad nauseum on every major news network, plastered around every trending social media platform, and echoed by every government sanctioned health authority, is that ivermectin is, well, it's horse dewormer. That's the label they slap on it, isn't it? A crude, dismissive, deliberately misleading soundbite designed to evoke images of terrified farmers rushing to the local feed store for veterinary-grade medication. It's a tactic as old as time: dehumanize the opponent, ridicule the idea, and shut down any semblance of nuanced discussion. Why? Because nuance doesn't sell advertising. Nuance doesn't reinforce the power structures. Nuance doesn't push the narrative that only expensive patented drugs developed and distributed by the very entities that profit from them are the only path to health. Contrast this with the counter narrative. The narrative isn't born in a boardroom or crafted by a PR firm. It's emerging from doctors who are on the front lines, treating patients, seeing firsthand what works. It's coming from researchers who are conducting studies, not for profit but for truth. It's bubbling up from grassroots movements, from ordinary people sharing their experiences and their findings, often at great personal risk. What does this counter narrative say? It says that ivermectin, when used appropriately and at the correct dosage, has shown remarkable efficiency in treating a wide range of conditions. We're not just talking about parasites anymore. We're talking about potential antiviral properties, anti-inflammatory effects, and a proven ability to be a safe and early treatment option. These are not fringe theories. These are observations backed by preliminary studies, anecdotal evidence from thousands of clinicians, and a growing body of peer-reviewed research that the mainstream media conveniently ignores or actively censors. Think about the sheer volume of data. In the early days of certain global health challenges, as the narrative solidified around a particular approach, many independent researchers and doctors began experimenting with repurposed drugs. Ivermectin was one of them. What they found was, frankly, astonishing to those willing to look. Studies emerged from various countries conducted with varying methodologies, but often pointing to a significant reduction in viral replication, faster recovery times, and decreased symptom severity. Yet, what was the response from the establishment? Instead of engaging with this data, scrutinizing it rigorously, and encouraging further well funded research, the reaction was swift and brutal. Major medical bodies issued blanket condemnations. Regulatory agencies issued stern warnings. Social media platforms began flagging, downranking, and outright removing any content that discussed ivermectin's potential benefits. It was censoring on a scale we haven't seen in decades, all under the guise of protecting public health. But who exactly are they protecting, and from what? From a cheap, effective drug that doesn't fit their multi-billion-dollar profit model? From a solution that empowers individuals to take control of their health rather than passively accepting whatever is prescribed? Let's talk motivations. The pharmaceutical industry is a behemoth. Its primary driver is, by its very nature, is profit. When a new drug comes along, it needs to be patented to recoup research and development costs to generate massive returns for shareholders. Ivermectin, however, is old news. It's off patent. It's cheap. There's no financial incentive for big pharma to promote it as a novel, groundbreaking treatment. In fact, their existing financial model often relies on the success and widespread adoption of newer, more expensive alternatives. Then you had the regulatory bodies, the so-called gatekeepers of medical science. Are they truly independent arbiters of truth, or are they influenced by the very industries that they are supposed to regulate? When funding streams are intertwined, when revolving doors exist between government agencies and pharmaceutical companies, it's natural to question their objectivity. The narrative pushed by these agencies often aligns perfectly with the interests of these drug manufacturers and the media. They are beholden to advertisers, and guess who the biggest advertisers are? You guessed it. Plus, the modern media landscape thrives on sensationalism and conformity. Challenging a widely accepted narrative, especially one supported by powerful institutions, is risky. It's easier, safer, and more profitable to simply parrot the official line, to ridicule dissenters, and to create a hostile environment for any information that contradicts the approved script. This is where the truth teller persona, the core of what I stand for, comes into play. We are not trained in corporate boardrooms. We are not beholden to advertisers or political masters. We are individuals who believe in the power of critical thinking, in the pursuit of truth, and the fundamental right to liberty, especially when it comes to our own bodies and health. The suppression of ivermectin is a symptom of a larger disease, the erosion of trust in our institutions, and the consolidation of power in the hands of a few. It's an attack on the very principles of the American soul, the spirit of independence, the courage to question authority, the belief that can and must prevail, even against overwhelming opposition. When you see a drug that has been a Nobel Prize winning miracle for parasitic diseases suddenly demonized as a dangerous veterinary product, you have to ask who benefits from this manufactured consensus? Who profits from the fear and confusion? Who gains power when individual choice is replaced by mandated compliance? It's the empire striking back, attempting to silence any challenge to its narrative. It's the same old story, just repackaged for the new era. They want to control the information, control the discourse, and ultimately control the people. They want you to remain dependent, to believe that you are incapable of making informed decisions about your own health without their guidance. But here's the thing about the American soul, about the libertarian spirit. We don't go gentle into that good night. We push back. We question, we research, we share information, even when it's unpopular. We support the doctors and scientists who dare speak out, who refuse to be intimidated, who understand that their primary allegiance is to their patients and to the truth, not to pharmaceutical profits or government mandates. The Great Divide is not just about ivermectin. It's about the fundamental principles of freedom. It's about whether we will be subjects or sovereign individuals. It's about whether we will accept the information fed to us or whether we will dig for the truth ourselves. It's about recognizing that the loudest voices are not always the most truthful, and that sometimes the greatest acts of rebellion are simply asking the right questions and refusing to accept the prescribed answers. This manufactured controversy around ivermectin is a clear example of how easily public perception can be manipulated. The vilification, the censorship, the ridicule, these are not the hallmarks of genuine scientific debate. They are the tools of control. They are designed to silence dissent and to ensure that only official sanctioned narratives prevail. But we're not playing by their rules. We are building our own narrative, one based on truth, critical thinking, and the unwavering belief in individual liberty. So as you navigate this complex landscape, remember to question everything. Look beyond the headlines. Seek out the independent voices. Support the researchers and doctors who are doing real work because the freedom is linked to the fight for all of our freedoms, and it's a fight worth having. With every verse, every chord, and every truth-telling musing. All right. We've been talking about fighting for truth, for freedom, for the ability to make our own choices. And a huge part of that self reliance, the ability to stand on your own 2 feet, is having access to the absolute essentials. And I'm talking about something as fundamental as clean, pure water. If you can't be free, if you're relying on a system that could fail you when you need it most. We've seen supply chain disruptions. We've seen the vulnerabilities exposed. That's why having your own reliable source of clean water is not a luxury. It's a necessity for anyone serious about preparedness and personal sovereignty. That's where Alexapure comes in. Their water filtration systems are built tough, designed to remove contaminants and deliver crisp, clean, safe drinking water from virtually any source. Think about it. Whether it's tap water you're not trusting, rainwater you're collecting, or even water from a questionable pond in a true emergency, Alexa technology gives you peace of mind. It's about taking control. It's about ensuring your family has what it needs, regardless of what's happening in the wider world. This isn't about fear mongering, it's about empowerment. It's about having the tools to live freely and responsibly. I've seen their systems, I trust the commitment to quality, and I believe in their mission to provide reliable water purification for every home. So if you're ready to secure your water future, to take that critical step forward, true self-reliance, head over to alexapure.com. That's ALEXAPURE.com. Equip yourself with independence. You know, the journey we're on today, questioning narratives, seeking truth, and building a life to freedom. It's a journey we can take together. The best place to find the fuel for that journey, the music, the ideas, the community, is right where I live online. At StephenLeak.com, you'll find more than just my music. You'll find my books, my writings, my thought-provoking Vimeo on-demand specials like The Writer's Life, Morning Jams on the Porch. It's a hub for the authentic voices I champion, the artistic risks we take, the unwavering commitment to speaking truth to power. And then there's Stephen Leak Radio. It's more than just an internet station. It's a lifeline for the liberty-minded. Through our mobile app, you can tune into shows like Life and Times, Midnight Confessions, and Wake Up America. We deep dive into current events, pop culture, technology, and spirituality, always through the lens of libertarian and constitutional values. We offer practical tips, tricks, and techniques for personal and collective liberation. It's where you can hear the unvarnished truth, uncut and unfiltered. So whether you're looking for music that stirs the soul, literature that challenges the mind, a radio that ignites the spirit, make your way to StephenLeake.com. That's STEVENLEAKE.com and download the Stephen Leak Radio app. Connect with the movement, support authentic voices, and keep the flame of freedom burning bright. We're in this together, and real revival starts with you connecting to the source. That's StephenLeak.com. We're back, freedom lovers, and you know what's essential for the freedom? Self-reliance. Anecdotes, studies, and the right to choose. Welcome back, fellow travelers, on the road less traveled. We've talked about the history, the narrative warfare, and the vital importance of preparedness. Now let's get down to the heart of the matter. We're talking about ivermectin, yes, but more than that. We're talking about a fundamental human right. The right to choose what goes into your own body, the right to access information, to consider all evidence, and to make decisions free from coercion or manufactured consensus. In this era of unprecedented control over information, where dissenting voices are often silenced with a click and valid research is buried under a mountain of politically motivated censorship, it's crucial to remember where the real power lies. It doesn't lie with the pharmaceutical giants, the bureaucratic health organizations, or the compliant media. It lies with you. It lies with the individual, and that, my friends, is where constitutional principles and our natural rights truly shine. Let's address the elephant in the room. Anecdotal evidence. The establishment loves to dismiss it. It's just stories, they say. It's not science. And sure, in a controlled clinical trial setting, we might aim for more. But what happens when the official channels are blocked? What happens? When the very institutions that are supposed to be seeking truth are actively suppressing it? What happens when your own doctor, perhaps pressured or misinformed, dismisses your concerns and refuses to explore viable options? In those situations, anecdotal evidence becomes not just valuable, but vital. It's a whisper network of truth. It's a collective experience of people on the ground, experiencing outcomes that defy the official narrative. It's the stories of doctors, nurses, and individuals who have seen ivermectin work when nothing else did. These aren't just random occurrences, they are data points, albeit in a different format than what the mainstream prefers. Think about it. For decades, ivermectin has been used safely and effectively in a vast array of parasitic infections. It has earned a Nobel Prize for its impact on global health. Yet when it comes to other potential applications, applications that might disrupt lucrative markets, suddenly the same drug is branded as dangerous, ineffective, and relegated to the realm of horse dewormer. The narrative conveniently ignores the vast amount of research and the numerous studies, both in vitro and clinical, that suggested potential benefits for various conditions beyond its established antiparasitic use. These studies, conducted by scientists and physicians worldwide, often point to ivermectin's antiviral, anti-inflammatory, and immunomodulatory properties. They're often published in peer-reviewed journals, yet they are systematically downplayed, ignored, or actively attacked by the established medical and media apparatus. Why? Because they don't fit the pre-written script. Because they challenge the narrative that only new, patented, expensive treatments are the answer. Because they empower individuals with affordable options. This is where we, as libertarians, as independent thinkers, as people who believe in the foundational principles of this nation, must stand firm. Our commitment is not to a particular drug, but to the principle of medical freedom. It's about the unalienable right to make informed decisions about our own bodies, our own health, and our own lives. The right is enshrined not just in common sense, but in the very bedrock of a constitutional republic and the natural law that predates any government. The Declaration of Independence speaks of life, liberty, and the pursuit of happiness. The right to liberty inherently includes the right to bodily autonomy, the freedom to control one's own physical person. This isn't a privilege granted by the state, it's a fundamental human right. Mandating medical treatments, or conversely suppressing the potentially beneficial ones, directly infringes upon this core liberty. Furthermore, the principle of informed consent is paramount. Informed consent means that individuals must be given all relevant information, including potential benefit, risks, and alternatives, in a clear and understandable manner, without coercion, before agreeing to any medical intervention. When information about treatments like ivermectin is actively suppressed, or when the narrative is so heavily biased against it, true informed consent becomes impossible. How can you consent to a treatment if you're not allowed to know about all the options, including those that might be effective and affordable? This is one of my personal philosophy rooted in Jesus, the Constitution, and the kind of American soul that refuses to be bought, sold, or silenced comes into play. My faith teaches me to seek truth and to act with compassion, often through actions that challenge the established order for the good of others. The Constitution, particularly the Bill of Rights, is a bulwark against governmental overreach, protecting the individual liberties, and that stubborn, resilient American spirit. The DIY can do attitude is about taking responsibility for ourselves and our own families and refusing to be dictated to by any power structure. The suppression of ivermectin. especially when we consider the sheer volume of anecdotal successes and the growing body of challenging scientific literature. It feels like a direct affront to these principles. It suggests a system that prioritizes control and profit over individual well-being and the freedom of choice. It creates a situation where individuals are forced to either comply with a potentially flawed or incomplete official recommendation or go against the grain, often facing ostracization, professional repercussions, or censorship. We see doctors who have bravely experimented with and advocated for ivermectin, often sharing incredibly positive patient outcomes. These are the real truth tellers, the ones who are embodying the spirit of scientific inquiry and patient advocacy. They are often the ones who are vilified, deplatformed, or even lose their licenses for daring to deviate from the prescribed orthodoxy. It's not science, it's a witch hunt. The core message here, the one that resonates deeply with the values I champion through my music, my writing, and this podcast, is that your body is your own. Your health decisions are your own. You have an absolute right to access information and explore all available avenues of treatment, especially when those avenues are affordable and have a history of safety. This isn't about promoting a specific drug. It's about promoting the right to explore any and all positive, potentially beneficial treatments without fear of reprisal or censorship. It's about advocating for a healthcare system that respects individual autonomy and prioritizes truth over profit and narrative control. It's about recognizing that when established institutions fail to provide transparency and suppress viable options, the responsibility falls back on us, the people, to do our own research, share our findings, and stand up for our fundamental rights. The fight for medical freedom is inextricably linked to the fight for all our freedoms. It's about reclaiming our sovereignty, one informed choice at a time. And in that pursuit, the experiences, the studies, and the sheer volume of anecdotal evidence that points towards ivermectin's potential benefits cannot and should not be ignored. We must continue to seek truth, to question the narrative, to assert our inalienable right to choose. This is what it means to live a life of liberty. This is what it means to embody the American soul that refuses to be bought, sold, or silenced. And this is why we keep digging, keep questioning, and keep speaking truth to power, no matter the cost. You're tuned in to Musings of a Cigarette Smoking Man because you value truth, freedom, and authentic voices. But this podcast is just one facet of a much larger movement, a creative rebellion fueled by the same principles you cherish. I'm talking about the world of me, Stephen Leake, all under the banner of Monarch Literary. Head over to StephenLeak.com and StephenLeakMusic.com to dive deep. You'll find my albums, Truth is Power and Love Kills, raw and real music for the liberty minded. But it doesn't just stop there. Monarch Literary publishes my novels like Gethsemane and Unplugged, and poetry collections, Truth is Power, Light Through the Pines, and Naked Shadowboxing. Art that speaks truth to power, challenges narratives, and inspires you to stand for freedom. Looking for something visual? Check out my Vimeo on-demand shows, The Writer's Life, Morning Jams on the Porch and in the Studio, offering intimate glimpses into the creative process. And keep an ear out for an evening with Stephen Lee, my upcoming homecoming concert special. Monarch Literary Limited is more than a company, it's a collective, a hub for genuine voices, for artists who aren't afraid to take risks and speak their minds. If you resonate with the ethos of this podcast, you'll find kindred spirits in my music, my writing, and my entire body of work. Visit StephenLeak.com and StephenLeakMusic.com. That's StephenLeake.com and StephenLeakeMusic.com. Support the movement. And let's build a freer world, one song, one poem, one truth-telling word at a time. Beyond Ivermectin, a call for medical and personal liberation. Welcome back to Musings of a Cigarette Smoking Man. We've delved to the history of ivermectin, dissected the narrative wars surrounding it, and asserted our right to choose. But as we've navigated this complex terrain, it's become abundantly clear that this isn't just about one drug. This is a microcosm, a potent symbol of a much larger ongoing struggle for liberty, a struggle against the institutions that often prioritize profit and control over genuine individual well-being and freedom of thought. The ivermectin debate, in all its contentious glory, serves as a powerful lens through which we can examine the broader implications for medical freedom and personal autonomy. It highlights how easily public discourse can be manipulated, how quickly dissenting voices can be silenced, and how the very foundations of trust in our established health and information systems have been eroded. For us, the libertarians, the free thinkers, and the truth seekers, this isn't just an interesting case study, it's a clarion call to action. We live in a world where information is both abundant and paradoxically heavily curated. The powers that be, whether they wear the suits of big pharma, the robes of bureaucratic institutions, or the mask of a compliant media outlet, have become adept at shaping narratives. They create a reality tunnel, guiding public perception through a carefully constructed series of messages, often leaving those who dare to question on the narrative to on the outside, labeled as misinformed or even dangerous. The manufactured consensus, this insistence on a single approved viewpoint, is anathema to the very spirit of liberty. True freedom, the kind that resonates in every chord of my music, the kind that underpins the foundational principles of this nation, requires us to cultivate a spirit of skepticism, not cynicism, mind you, but a healthy critical inquiry. It demands that we question authority, even when that authority is prescribed, presented as infallible. The very essence of my work as a poet, a songwriter, and a storyteller is all about digging deeper, about speaking truth to power, about reminding people of the inherent dignity and sovereignty they possess. When I sing about resistance through melody, it's not just a catchy phrase, it's a philosophy. It's about using art, information, and critical thinking to push back the forces that seek to control and homogenize our experiences. It's about fighting for decency, justice, and common sense in a world that seems often to have lost its way. The Ivermectin saga is a prime example of how this battle for common sense is waged. When a drug that with decades-long Nobel Prize-winning history of safety and efficacy against debilitating diseases is suddenly demonized and suppressed, it sends a clear message. Your autonomy is secondary to the established agenda. Your ability to research and decide for yourself is less important than your compliance with the prescribed narrative. This is where personal responsibility comes into play, more powerfully than ever. We cannot afford to be passive recipients of information. We must actively seek out alternative sources, engage in rigorous personal research, and develop the critical thinking skills necessary to discern truth from deception. This means looking beyond the headlines, questioning the narratives and motivations of those who control the narrative, and valuing the insights of independent researchers, doctors, and citizen journalists who are often working against the current. Think about the platforms and resources that empower this kind of independent exploration. Websites dedicated to compiling research, forums where professionals share their experiences, and even podcasts like this one are all part of a decentralized network of truth seeking. It's about building as an ecosystem of information that exists outside the control of the traditional gatekeepers. It's about empowering ourselves and each other to navigate a world of manipulated narratives. For those of you listening who feel that nagging sense of that something isn't quite right, that the official story doesn't add up, I urge you, lean into that feeling, cultivate it, use it as fuel for your own quest for understanding. Don't be afraid to ask an uncomfortable question. Don't shy away from information that challenges the mainstream. The path to personal liberation is paved with critical inquiry. It requires us to shed the comfortable blanket of unquestioning acceptance and to embrace the sometimes difficult but always rewarding process of independent thought. Whether it's about a medication, a geopolitical event, or the very nature of reality, the principle remains the same. Your mind is your own, and you have the right and indeed the duty to use it freely. This is the core of what Monarch Literary Limited represents and what drives my work. We champion authentic voices that speak truth to power, that take artistic risks to challenge existing narratives, and that inspire others to take a stand for freedom. From the lyrics of my songs to the pages of my books, the message is consistent. Do your own research, trust your own judgment, and never let anyone else dictate your truth. The fight for medical freedom is a fight for bodily autonomy, the right to informed consent, the very essence of self-governance. When institutions attempt to control what we can and cannot access, what we can and cannot believe about our own health, they're chipping away at the bedrock of our liberties. The ivermectin debate is a stark reminder of this danger. So let this be more than just a discussion about a drug. Let it be a catalyst for you to engage more deeply with your own health choices, to question the information you consume, and to recognize the immense power you hold as an individual. Embrace the spirit of inquiry. Support those who are bravely speaking truth. And remember that in the pursuit of freedom, the most powerful tool you possess is an uncompromised, critically thinking mind. That's the real revival we're after. And it starts with each and every one of us taking personal responsibility for our own liberation. Are you tired of the same old corporate controlled airwaves? Do you crave authentic voices, uncensored counterculture insights, and consistent libertarian thought? Then tune in to Stephen Lake Radio, also owned and operated by Monarch Literary. It's more than just a radio station, it's a movement. Download the Stephen Lake Radio mobile app from your favorite app store and get instant access to a range of original shows. Hear me on Life and Times, where I share my personal journey and insights. Delve into the shadows with Midnight Confessions, or start your day with a dose of truth on Wake Up America. Join the battle and in the trenches, and find solace in sovereign thought on Sunday Sovereign. Stephen Lake Radio is your vital source for music, discussion, and truth that refuses to be silenced or manufactured. It's the perfect soundtrack for waking people up and championing the values of freedom and personal responsibility. Download the app today and make Stephen Lake Radio your go-to station for authentic voices and liberty-minded discussion. Conclusion: keep the flame of freedom burning. We've explored ivermectin, challenged narratives, and championed individual liberty. Our key takeaway: question everything. Seek truth relentlessly. Uphold your freedom above all. My mission is to remind you what freedom sounds like and to take it back. Don't just consume this information, engage with it, share it. Continue the fight for freedom, decency, and common sense. The empire will not yield otherwise. For more truth telling content on Musings of a Cigarette Smoking Man, wherever you get your podcasts, explore Monarch Literary Limited's books, music, and more at StephenLink.com and StephenLinkMusic.com. Never surrender your sovereignty. Thanks for hanging out with me today. It's been real fun. I hope you got something out of this podcast. I'm Stephen Lee, the cigarette smoking man. Thanks for hanging out. We're going to win.